PANADO Pediatric Syrup 5ml sachets. They're really convenient to pack and easy to use, so you're always prepared for pain and fever, anytime, anywhere.
It is your feel-good breakfast show, everybody. And as we know, life is full of surprises, and knowing how to handle a crisis makes it that much easier. Today, we are talking to emergency medicine specialist, Dr. Ibrahim Untitled, to help guide and also give us the security we need to handle moments of crisis. And Doctor, I wish I met you 2 weeks ago because I needed this. My little one went to his first emergency unit because he fell, broke his lip open. And as a mom, and as a parent, I panicked and I screamed and I didn't have the basis. But when it comes to this, you know, sometimes it is so crazy. We don't know what to do. But take us through it. When it comes to a medical emergency or crisis, what is the basics that we as parents need to know?
So, yeah, thank you for being here. The emergency room is a scary place. And everyone who comes is always in a panic, particularly parents of kids, because you don't want anything to happen to your kid. So the most important thing, I think, with injuries and damage to children is prevent it from happening. Easier said than done once it's happened. But emergency medicine is a specialty where we are trained and experts, masters of dealing with anything that's going to kill you or harm you or result in people feeling bad. So often people don't understand the system in the emergency room, that we've got a triage system. So when patients are in the emergency room, we know exactly what's happening with all the patients that are there. We know who's at risk of dying, who's at risk of having a serious injury, and who can wait to still be seen. And I think understanding that can allay a lot of the anxiety that parents feel when they can't be seen immediately in an emergency room. So there's a few things in terms of when your child is injured or hurt. If there's an open wound like your child had, it's a lot of bleeding. The easiest thing to do is just to simply compress it, and that will stop the bleeding and prevent massive blood loss. If the child is unconscious or not responding after a fall, then obviously the next step is to get them to an emergency room where they can get attended to and get help for that injury.
Is there something called emergency medicine? Because we all need that. We need that in our little cupboard in case of these instances. So is there something called emergency medicine?
Emergency medicine?
Yeah.
That you can just take anything? I wish there was. But it would put me out of a job.
That's true.
So you get emergency physicians, and emergency physicians are those who can actually treat any sort of emergency condition. You know, a lot of people don't know emergency medicine is quite a new discipline in South Africa. It's been around for about 15 years. And a lot of people don't know exactly what emergency medicine is. So emergency medicine, to put it succinctly, is the most interesting 15 minutes of any medical specialty. So basically, whenever anything goes wrong, that's what emergency medicine is trained to do. Whether it's gynecology, psychiatry, obstetrics, orthopedics, all of that. Emergency medicine can deal with all of those conditions. Unfortunately, there's no emergency medicine per se that you can take out of the cupboard.
One thing takes all.
No, for sure. And I see you've got a lot of PANADOs here. PANADO's great. It's generally safe, except in patients who have liver conditions. But it's generally for children who are having pain. It can be used from all ages, from 3 months upwards. Can be used for all sort of painful conditions. And it's quite an effective analgesic that works on the mind and changes the body's response to pain.
And then in terms of a paracetamol, how often should it be administered when you know you are in that crisis, whether your child falls or they got hurt or they are under pain? So how often should it be administered?
So the best way is just to follow the advice on the box, unless you've spoken to a healthcare provider. So the advice on the box, sometimes it is a bit lower than what a doctor would give, but it is considered to be safe for all sort of weight ranges, all sort of sizes of people. So if you don't know, you haven't consulted with a healthcare provider, just follow the instructions on the product.
Are there any risks when it comes to administering these paracetamols with any of the injuries that your children will be foreseeing, for instance? So are there any risks?
Not generally. I mean, unless there's liver failure or pre-existing conditions, but then you should hopefully know about that. The one thing is if you give it too often, that can be a big problem. So one really needs to just stick to the guidelines on the product, because if you give it very frequently, then it can cause problems, can cause damage, more than what is advised. So the recommended dosaging is considered to be safe. and that doesn't cause major problems.
6-2, what is on the box? Dr. Ibrahim, it was so good to have you again. I wish I met you 2 weeks earlier because you would have put my mind at ease, but hopefully you have put everyone in Mzansi's mind at ease. Now, if you haven't already, share this with fellow parents, maybe some friends, and also family to ensure that you are as prepared as can be should you ever find yourself in a medical emergency where child's health is at risk.
Being a parent can be challenging, but stepping out is when things get real complicated. That's why new PANADO Pediatric Syrup 5 ml sachets are here to make the job easier. They're really convenient to pack and easy to use, so you're always prepared for pain and fever anytime, anywhere. PANADO, a dose of care.